Hey everyone, I'm so excited to have Krista, the cancer prevention coach, on, and she will be joining me momentarily. And it's going to be a great morning. So continue to send in your questions. I've had a lot of questions from people about, there she is. Hi,
Hi,
beautiful friend. I was
good
just
morning.
telling our audience we have lots of questions queued up
Oh, awesome.
that people have been sending in. And, this is a topic that piques a lot of interest and can also be really terrifying. So,
Yeah.
how about that as an intro? Good morning.
Good morning. I'm happy to be here.
I'm so glad because the last time we talked in public was our podcast, which was a year and a half ago, which I'm actually re-releasing today because it was just so powerful. But a lot of things have changed in your life in the last year and a
Yeah,
half.
a lot.
You want
Yeah,
you want to give us an update?
sure. Yeah, well, the biggest thing will be that I was diagnosed with cancer. So when we talked and did that podcast, I was kind of in the beginning of my Instagram account, and I am the carrier of a high risk genetic
Yeah.
mutation that can be passed down to families. And so I had found out that I was positive for a gene mutation that increases my risk for breast cancer a lot, so a
Mhm.
69%. And so at that time, I was
Wow.
kind of considering a preventative mastectomy
Hmm.
and reconstruction. And um, if you have one of those high risk genes, the recommendation is to do screenings every 6 months. And so I was alternating between mammograms and MRIs. And one of my MRIs showed an abnormality as I
Okay.
was planning the surgery. And so I don't know how much detail you want me to go into. There was a lot of self advocacy that had to be done.
Mhm.
I was told over and over again that it was a lymph node, but knowing my risk, I kind of had to push a little bit to get more testing. And long
Really?
story short, yeah, long
So,
story short, sorry, go
with a
ahead.
69% increased risk, you still had to
I
push
did.
your provider?
I did. So
Okay.
my after my MRI, I did a diagnostic mammogram and
Hmm.
ultrasound, and they basically said, "Yeah, it looks like a lymph node. Follow up in 6 months." And I just felt really uncomfortable with that because of my risk,
Yeah.
especially. And
Yeah.
um, imaging is very a great tool, but also imperfect, like everything kind of in the cancer world, right? All these
Hmm.
screening tools that we have. And so I pushed. We did another ultrasound in office with um, breast surgeons, and had two of them tell me 99% sure this is not cancer. Still felt really uncomfortable, so I requested a biopsy, and it did come back. It was showed DCIS at that time.
Hmm.
Luckily, my preventative surgery that I had planned for it was in place and
Hmm.
scheduled just 2 weeks after that, and so I felt very grateful for that. But my surgical pathology came back showing stage 1A, and it was very high grade. It was a grade 3, and
Yeah.
so it was aggressive and would have spread quickly. And so I feel
Mm.
very lucky, but you know, here we are. So yeah, it's been kind of a long road. And so then we had surgery, 2 rounds of surgery, and then recovery. And so yeah, a lot has happened since
A
our first
lot has
time.
happened. And so I guess what does somebody do if they're not pushing? Because I think that maybe if you hadn't been you, where you have got a great medical background, your mom passed away from breast cancer. You knew you needed to push. What about somebody who is not
Yeah,
a pusher?
you know what? It was hard for me, even with my medical background
Mm.
and knowing about understanding the risk, which um, makes everyone a little more nervous. But it was hard for me. I think it's hard for anybody, right? Like you really start questioning yourself. Like 3 or 4 providers have told me that this is not cancer. I'm okay, right? Like you start thinking, maybe I'm just crazy. Maybe you start questioning
Yeah,
yourself. Everyone does. And so I think
everyone
the important
does.
thing to know is that, and as a nurse and taking care of patients for years, something that I've learned is that when a patient has gut feeling, you listen, right? Like
Mm.
sometimes those gut feelings are the best diagnostic tools that we have. And
Hmm.
so don't question yourself. Don't question your intuition. Just, it's okay if you feel stupid pushing. You can always request and obviously be nice about it, right? You don't have to be
Sure.
rude, but yeah, I mean, say I really feel uncomfortable with these results. I would like further testing. I would like you to order some
Yeah.
further,
Yeah.
and that's okay. You're
It
allowed
is
to do that.
okay, and it's
Yeah.
okay to push. And what you said just now is trust your gut. And
Hmm.
if your gut is saying, let's go to the next round of testing, then you go to the next round of testing, even if you make people mad or they think you're crazy or whatever it is,
And
it's
even
okay
if
to
it's
push back.
negative, right? Even if the
Right,
results show nothing, at
right.
least then
That is
right?
so true. At least you know,
Mhm.
and then you can check that box and sleep well at night. But
Yeah.
yeah, I think that trusting your gut is one of the most important things we can do in all aspects of our life, from
Hmm.
walking through a dark parking lot at night. Trust your gut. If you think there's something, happening or about to happen, have somebody walk with you, to going to the doctor and, bringing somebody with you if you feel like you're not in a place in your life to push.
Yeah, I agree.
Yeah. Yeah. Okay. So you went through a lot of surgeries, a lot of surgeries. We've actually had a couple of side conversations
Yeah,
about
we
this,
have.
because I'm considering doing the type of reconstruction that you did. What drove your decision to do the type of reconstruction you did versus basically there's options of an
Hmm.
implant. There's an option of having no breast or no breasts, or doing a deep flap.
Yeah. Yeah, that's a great question. And it's one that I do like talking about because I feel like a lot of times as patients, and from what I hear from other people, is that you're not always presented with all of your options. And so
Hmm.
my goal is really to help people make the most informed decision, right?
Right.
But for me personally, I like we talked about, I watched my mom go through breast cancer, and she chose implant reconstruction. That she was offered aesthetic flat closure is the name for if you don't want any kind of reconstruction, really. So there's aesthetic flat closure, and then there's implant-based reconstruction, and then flat-based reconstruction, which is what I chose. And you'll also hear that called autologous reconstruction,
Hmm.
or like natural tissue reconstruction. And so basically, what they do is take tissue from another part of your body. Um, Commonly, it comes from your abdomen if you have it there. Sometimes from different parts of your body, wherever you have the most fat and what your surgeon thinks is best. But for me, it was from my abdomen. And so that's called deep flap reconstruction,
Hmm.
DIEP. And using your own tissue um, to for reconstruction rather than like an implant. And
Right.
so I knew I wanted some kind of reconstruction. And in the beginning, I didn't really know about flat-based reconstruction, even after watching my mom's whole journey. And so her experience with implant-based reconstruction really played a huge role in my decision. And
Mm.
because she had a lot of complications, lots of surgeries, infections linked to the implants, and just years and years back and forth
Mm.
correcting things and lots of surgeries. And I just had like PTSD
I'm
from
sure.
watching her. And I'm the one that was kind of in the hospital with her a lot of the time.
Hmm.
And so just watching her go through that, I really couldn't wrap my head around doing that myself,
Yeah.
right? Even though there are lots of people that have that, have implant-based reconstruction, and they're totally fine, right? But
Yeah.
my personal experience really drove my choice.
I'm
And so
sure it did. Yeah.
so, but yeah, I chose deep flap reconstruction. And so they took tissue from my abdomen, and basically it's like a transplant, and they reconnect vessels and use that in place of an implant. And so
Hmm.
I don't know how much you want me to share about that.
Well, so you're happy with your
I
decision?
am, yeah,
Yeah.
I'm very happy.
It was a long surgery, right?
Yes, 8 hours. Um,
That is long.
So yeah, it's a little bit longer up front, but one of the things I love about deep flap reconstruction was that it's like a one and done. Like sometimes with implants, the recommendation is depending on the doctor. I was told every 10 years you need to have those replaced, give or
Mm-hmm.
take, right? Give or take.
Mm-hmm.
And I'm not somebody who ever wants to do surgery again, and so that was another reason.
I hear you, girl.
You know, so I'm like, I wanted to limit that. I had
Mm-hmm.
3 C-section babies, and I don't know. I'm a nurse, and I can watch surgery all day, but the thought of going back to surgery every 10 years for the rest of my life was something that I did not want to do.
Yeah.
And so that was a huge perk for me. Like you have one main surgery, a second surgery typically that's called the revision, where they kind of go in and fix a few things,
Mm-hmm.
and then you're done.
Yeah.
And so I loved having that light at the end of the tunnel
Sure.
to be able to say, okay, I'm done. Like I don't have to think about this anymore,
Right.
hopefully. And that's, of course, not always the case for everybody,
Mm-hmm.
because there are always complications you have to consider. But in general, it's typically fewer surgeries. And so I was happy with that.
And the breast is different than, for example, I'm an implant-based reconstruction, and my breast is always cold. It's harder than it
I
should
hear that
be.
a lot. Yeah.
Yeah, and so what I'm being told from our conversations, but also my plastic surgeon, is that it's supple. It feels like a real breast because
Yes.
it's made out of your
Yeah.
own body.
It
Yeah,
does. It feels to me exactly how my real breasts felt. Like, not real, but you know what I
for
mean, for lack of a better
your
term.
first
Right?
version.
My originals.
Yeah, your
Oh.
originals. Really interesting. Okay, so in kind of looking back at your journey, um, your career, how you've taken care of yourself. Um, I bet a lot of people look at you and say, wow, if you got breast cancer, what hope is there for the rest of us?
Yeah. And a lot of people think that, and I really, I knew from the beginning, right? Like nutrition and lifestyle plays a huge role in our environment.
Huge.
Like, they play a huge role in cancer development and progression. They do. But we also know that no matter how perfect you are, like cancer is just like a different kind of beast, right? Like there's
Hmm.
no 100% guarantee. And so many factors play a role in cancer development that, there's no 100% way of saying, if I do this, I'm not going to get cancer. There's not like one thing that you can just do and never get cancer. Like,
Right.
it's,
There's
yeah,
not a food
like,
you can eat that's going to prevent it. There's not a
yeah,
food that you're eating that's going to, like, say, this is going to cause cancer. Put this down.
right.
Right.
But also, my mindset has always been one of, if cancer does show its ugly face in my life, I want
Hmm.
to be as prepared as possible. And I want to be able, at the end of the day, I really want to be able to say, I did everything that I could to
Yeah.
prevent it. I
Yeah.
did everything that I could. And I don't know, for me, that brings a lot of peace. And the more that I've learned and studied and learned about nutrition and exercise and sleep and all of these things that play a role, that the more I believe, the more I have learned that it's like really it makes a huge difference in not only whether you get cancer or not, or like you have a recurrence, but also really how you get through, like whatever treatment you choose. If you choose like chemotherapy or whatever you choose at that point,
Right.
patients who are making those decisions and have a better like nutrition and healthy lifestyle are having better outcomes.
Hmm.
And so at the end of the day, for me, I know that makes it worth it to
Yeah.
me.
Yeah. You did all the things. You did all the things, but you were at a 69% higher risk. What, I can't even imagine the outcome with your diagnosis if you hadn't known about your 69% risk.
Mm-hmm.
You probably would have said, okay, great. They want me to come back in 6 months. And then maybe sometimes 6 months turns into 8 months. And then you'd be looking at a completely different diagnosis
Yeah.
and outcome.
Mm-hmm.
Tell us a little bit about genetic testing. Does it change? Does it get updated a lot? Is it better now than it was a year ago? And how does somebody know that they should get
Sure.
genetic testing?
Yeah. So Genetic testing has come a long way since the early 2000s. Originally, the first genes that they really discovered linked to any type of cancer were the BRCA mutations.
Hmm.
And so those were the only ones they were testing for a long time. But there was something called the Human Genome Project that happened where all of this research started going into genetics and how different changes in our genes play a role in different diseases. And so they have come a long way. And so I wouldn't say that necessarily like the testing changes, but they know more, like the more testing we're doing, the more links they're finding to different kinds of cancers and other diseases. And so genetic testing it's really, people get confused because there's also genetic testing when it comes to a cancer diagnosis, and they send off parts of your tumor and do different kinds of
Sure.
biomarker testing. So it's a little
Hmm.
different. The testing that I did was hereditary cancer genetic testing. And so it looks for genes that can be passed down through families. And so, like, my mom had this mutation. And so anyone with those mutations has a 50% chance of passing it down to their children. And so,
Okay.
yeah. And so, that's why I chose to do my testing. And, but it's not really hard to do. So, and it's gotten cheaper over the years. So,
Oh, good. Okay.
now, yes, yeah. And so, you can request this kind of testing, and I suggest this to anyone that has a family history of cancer. And it's not just breast cancer; it's like colon cancer,
Mm.
ovarian cancer. There are like pancreatic cancer. I'm at risk also with my mutation for pancreatic and a small risk of
Mhm.
ovarian. And so, but so you can request this from a family practice doctor. You can request it from your OB/GYN, and that's who I requested mine from because they're typically the ones who are ordering your screening test.
Sure. Hmm.
But a lot of times they'll want you to see like a genetic counselor prior to. And
Yeah.
we didn't talk about that a lot in the podcast, but that is something that I really encourage people to do because I did not do it that way. And I think I would have been more prepared if I would have seen a genetic counselor first. So I always recommend that now.
Hmm.
And they're kind of the experts in that space and know the most, even more than your doctor, about what testing is
Hmm.
appropriate for you in your family history and management moving forward. And so that's a great place to start if you don't want to ask your doctor.
Okay.
And some insurances even offer that like a telephone visit. So something
Really?
about they
Okay.
do. Yeah, that's my first genetic counselor appointment after I got my results was over the telephone. Yeah.
Okay. Genetic counselors. Okay. I have
And they're
not heard of a
amazing.
genetic
Yeah.
counselor. Okay. And so they'll be able to maybe prepare
Yeah.
you.
Yeah, they prepare you. They
Yeah.
take a deep dive into your family history and ask you so many questions. And then they can kind of adjust your testing to your personal needs, if that makes
Hmm.
sense.
Sure.
So,
Okay.
but just I like to tell everyone too, like everyone thinks it's going to be like thousands of dollars
Hmm.
when they hear about genetic testing. And right now, and you can get genetic testing, a full hereditary cancer panel for around $250 without insurance. Sometimes if you have insurance, they charge you more. You
Wow.
know how that goes.
I
But
do know how
um,
that
if you're
goes.
out of pocket, it's $250. So totally worth it,
Okay.
in my opinion.
Totally
Totally
worth
worth it.
it. Okay, are those resources, do you have that on your Instagram bio, or maybe you can send it to me and I can
Like
post it? Yeah,
how to find a counselor. Is that what
right.
you're
Yeah.
asking? Yeah, there are some websites that will help you find one. If you want to use your insurance, I would suggest going through your insurance company and asking them
Okay.
for in-network provider because same thing with doctors, they can be out of network,
Right.
So you
Okay.
want to make sure if you're using your insurance that you go through your insurance to find a provider. But
Hmm.
I can send you a link to a website that lists like all of the national genetic
Oh,
counselors.
that's great. That's
Yeah.
great. That's really good advice. Yeah, I love that. You wish you would have done it that way. So now you're educating
Yeah.
us on how to do it a
Yeah.
little differently
Yeah.
than
I'm going to do
than
it
you
a
did
little
it.
blind. Yes.
Yeah, yeah, I can imagine that that would be a lot of information to take on. And if you don't have a medical background,
Hmm.
and
Hmm.
maybe you have a little PTSD from watching a family member or family members
Yeah.
with cancer, that this would be a
Hmm.
really good way to go.
Mm, yeah,
Yeah.
they're great. They also have a little bit of like counseling in their education, so they're good people to talk to.
Okay, great. So, this is a question you and I've never talked about, but what are you hearing about the MRIs, the I forget the brand, Prenovo or
Yeah.
something, where you can do the full MRI and
Hmm.
it's,
Yeah.
do you know much about that? And if you
I
do, I'd love your
I
thoughts.
have, a lot of people love that option. It's
Mm-hmm.
at this point going to be all out of pocket, and so cost is a barrier to a lot of people.
Mm-hmm.
Um, that is one of those things that's going to be very personal, I think, because some people have a higher tolerance for things like they might find an abnormality and you're doing more testing and biopsies and things like that, and then find out there's nothing, right?
Yeah.
And so it's really going to depend on you personally, whether you want to pay for it and like how you handle abnormal results, right? Because
Yeah.
that's hard. People lose sleep over it, and like I don't know if it's called scanxiety, right? Like if you've ever had any of these screenings or scans, it is like you're like refreshing, waiting
I
for results and waiting for
know.
and like it's like this ongoing.
Gosh, it's terrifying. Yeah,
Yeah.
it's terrifying.
Yeah.
And I just had a pap smear and I wasn't hearing and I wasn't hearing back. And I thought, great,
Mm-hmm.
great.
Yeah.
Now
Well,
I've got this.
yeah.
And I just immediately, Krista went down this really dark hole. And so I reached out to my doctor and she sent me this note that, I mean, I have a science degree and I was like, hold on, what does this mean?
Mm-hmm. Mm-hmm.
All I saw was something that said abnormal. And then I sent a note as I was panicking. And she's like, "Oh, sorry, I didn't mean it like that. No, everything's fine. See you next year." And I
Yeah.
was like, "Oh my gosh, I
Yeah.
lost sleep. I had
Yes.
massive anxiety, and I never used to be like that." So I think that once you get a diagnosis, controlling the mind is not so easy.
True. It's true. And it's hard with anything that like if you have a possibility of it ending up with cancer, it's scary for everyone, right? But
Mhm.
there are definitely people that do better with like, okay, I had an abnormality, now I'm doing more testing and like the stress of all that is
Yeah,
so different for every person. And so I don't know, that's one of those things you just have to understand that like even if it's abnormal and you're doing further testing, it still might turn out negative. And so,
right.
like, how many hoops do I want to jump through to get this information is
Hmm.
really the question I think you have to ask yourself.
Yeah,
So,
yeah. Okay, that's good advice. And I've been considering doing it. Um, but then I just think, could I handle it? Could I
mhm,
handle the
mhm.
weight? And that was for me with cancer, that was probably the hardest thing for me was waiting for pathology to
Yes.
come back and trying to control that darn mind. Honestly,
Hmm.
was hard.
Yep.
Yeah.
It is. It's hard.
Yeah. So let's talk about the mind.
Okay.
Like that little softball I threw to you.
Yeah.
Let's finish with mindset. And tell me a little bit. You've been through a lot
Hmm.
from your mom being sick, watching that whole process, to your diagnosis. You have girls.
Hmm.
That's a lot of
Yeah.
mindset. Yeah. Yeah. You how do you stay positive? You're a joy. Every time I talk to you, you're
Yeah.
just a joyful person. Your Instagram, you're always smiling. You are a joyful person. How do you maintain that joy?
Well, I think I try really, really hard to really pick and choose the things that I allow into my life, people
Mm,
and accounts that I follow on social media, and because it can wear on you. Things can wear on you, and there's always somebody who has something that you shouldn't, telling you something you shouldn't be doing. Right in the cancer world, it's so
yes.
overwhelming. It's
Yes.
overwhelming, and so
Overwhelming.
yeah. And so I really try to focus on the things that I can control. And instead of like stressing out about what I can't do or what I shouldn't be doing and what everyone's saying and what, like, I really try to add the good. And we talked about this in our podcast too. Like, that's my focus is even when it comes to like nutrition, I'm looking for things that are like adding good to my life or bringing peace to my life.
Mm,
And I'm trying to, keep like do those things more, I guess. And so
yeah.
um, that's a big part of it. We talk a little bit about stress in the podcast too, and like things we can do to lower those stress levels. And that's a little different for everyone, but I still sit on my swing. And that's still my favorite place. And like I
So
know you do like
great.
grounding and things like that. So, I mean, just being mindful and like aware and like listening when your body is like, you have these feelings for a reason, right? Like
Hmm.
listening, trying to adjust, and really just keep my mind in a place that um, is more positive. I don't know. It's hard, right? Like we all have our days for sure, but
We
I think
do.
finding even like mantras that are helpful in the hard moments for me. We talked a little bit about like the in between surgery, right? Like
Hmm.
when you have a mastectomy and reconstruction, like your body's going through so many changes, and so one of my favorite things to say, and like even we say it in my house, my girls say it all the time now, like I say it out loud, like when you're in this place where like you're in the in between, that's like one of the things no one ever talks about, right? That in between
Hmm.
is so hard. And you're looking at your body and you're like, this is not me. For me,
Yeah.
I went down in size. And so my first surgery, they transplanted the fat, and then the second surgery, they made it look pretty. But in between, it did not look pretty, right?
Yeah.
And so, and I was dropping in size. And so I really just you look in the mirror and you're like, who is that person?
Who
Like, that's
is
not
that?
me. And so, one of the things that I started saying during that time that has really stayed with me is it's not forever, it's just for now. And I would say that when I was
Mhm.
in pain or when I was like, it's not forever, it's just for now. And
Yeah.
so it has really like those kind of things, like the things that you tell
Hmm.
yourself, it affects you, right? Like what you're saying and like how you're talking about yourself and what's happening in the situation is a huge part of mindset. And
Yeah.
so starting with yourself and like telling yourself it's going to be okay,
Hmm.
or whatever, you like keeping yourself positive and trying, I don't know, there's lots of things, but that has been what has helped me a lot.
Yeah. That's a really positive mindset. And it sounds like, that's really helped you through some really hard things. And to, you're playing a long game.
Mm-hmm.
Like you said, it's not forever, it's just for now.
Mm-hmm.
And we can do this for now. We can be in pain for now, and we can look down and have our breasts look funky for now. It's not forever. And there were so many times I'd look down, I'd just be like, oh my gosh,
What's
I just
happening?
want my old body back.
I know.
Yes. So mindset, it sounds like you've really figured it out.
Thanks. some
Yeah.
some days, we all have our
We
days, but
all have our
do our
days. We
best.
all have our days. Yeah. So I'll end with what are you most looking forward to for the rest of 2025?
I just, I'm really loving right now. I just took a job as an oncology nurse navigator a
Mm,
little over a month ago, and so I have been doing training for that, and I have really enjoyed that. I think for me, finding my purpose in helping others on
yeah.
their hard days has really like been amazing for me. And I've made so many connections like with you and people that are going through it. And I don't know, it just brings so much purpose to my life. And so
Yeah.
I'm really looking forward to like getting into that, and hearing the stories and the perspectives of others has really, really changed me for the better. And so
So
I don't know,
good.
that's one of the big things right now.
That's really,
Yeah.
really good. Yeah. You really turned a tough season into such a blessing to others.
Yeah.
Yeah.
You're sweet.
Yeah.
We learn a
Yeah.
lot from others, like each other, right?
We
And shared
do. Yeah, we do. Shared experiences. And, people often say with cancer, it's the club you never wanted to be
experience.
in. And that is so true.
What
But
they say, right? Best or
yeah,
work club, best members. That's what they
yeah,
say. Because the
that's
people
right.
are amazing.
People are amazing and kind and generous. And as soon as somebody knows that you've been through it, there's just like this instant bond and
Trauma
camaraderie that
bond.
is
It's the trauma bond.
the trauma. Oh, I haven't heard that. The trauma bond. I love it. Okay, well, I love chatting with you. But I've said this three times. Final question. You just got back from a fabulous vacation.
I
What
did.
was your favorite meal and your
Oh my
favorite
gosh.
place to visit?
Okay. It's hard because I loved all of it. So we went on a Mediterranean cruise, and I actually planned it because it was on my bucket list for so long. And when I got my diagnosis, I was like, I'm done. We're going. We're planning this trip.
We're
And
going.
we
Yep.
just went. And so we got to go to Italy and one stop in Turkey and then Greece, a couple different places. But I will say, out of all of our stops, I really loved Rome. But
Yeah.
that was for a different reason. But Amalfi Coast was probably my favorite.
Hmm.
It's beautiful. Like you look at it in pictures and it doesn't do it justice. It's
So
beautiful.
true.
So Amalfi Coast was my favorite, but I will say my favorite meal was in Greece. We did an excursion where they took us out like on a catamaran and we got to swim.
Oh,
And they made a like authentic Greek meal like right on the boat. And oh my gosh, I already love Greek food, but like it was the best. I never wanted to leave that boat. Like I was like, oh,
wow.
forever.
Oh my
So
gosh, that's
yeah,
really cool. What a great experience with your
it was
family.
great. Good
Yeah.
memories, and
Yeah.
hopefully they'll never forget my kids. So
Yeah. Oh, that sounds like a wonderful time. Well deserved. And I love that that was a bucket list thing. You got your diagnosis and you just said,
yeah,
booking.
you
Yeah,
need
we're doing
something
it.
to look forward to. You need something to look
Right.
forward to.
Yeah, the power of having something to look forward to is really real during a
Hmm.
diagnosis. So,
You
yeah.
know, yeah.
Yep, I do know. Yeah. Krista, I love
I
you.
know. I
I
love you.
can't wait to meet you in
I know.
person someday.
One day we will.
We
That
will.
ever comes. So
Yeah,
yeah.
thanks for coming on and having this conversation. Yeah, you are just a real blessing to both of our communities. And I've re-released our podcast today. So go to link in the bio, go give it a listen. It is so good. And now you have an update of Krista's life since then. So
Well,
yeah, thanks,
thank you
Krista.
so much. It
It
was good talking.
was good talking to you too. See you soon. Bye.